Hello friends, I'm Dr. Taylor at Family Focus Eye Care, Dry Eye Center of Salem. Let's learn a little bit about your eyes and how to keep them healthy. If you're watching this video, you probably suffer from meibomian gland dysfunction, ocular surface disease, or dry eye. In fact, they all overlap. They're all cousins to each other. Essentially, all three are saying the same thing. Your eyeball needs to stay wet in this very dry environment. The tear film has three big jobs. Number one, it's going to keep you comfortable. Number two, it's going to give you a protective layer against dirt, dust, and allergens. Number three, and what I think is the most important, it's going to give you nice, sharp, consistent vision. That's one of the biggest risk factors for dry eye, is blurry, inconsistent vision. Whether it's because you're having good days or bad days with vision, or you have to do these big, strong blinks just to see anything clearly, that's dry eye. That's a tear film that is falling behind on its job. We can fix that. 9 times out of 10, the problem are these glands on our eyelids. These glands on the eyelids, called the meibomian glands, they have an important job. Every time we blink, our eyelids come together, and these glands are going to express lubrication onto the cornea. Again, that tear film is going to help us to feel comfortable. It's going to be a protective layer against dirt, dust, and allergens. And very importantly, it's going to help us to see clearly. One of the reasons the system breaks down is because of all of our near work. We are constantly in front of screens. These screens are going to cause us to blink less. So these glands are falling behind. Not only that, but systemic inflammation can cause these glands to be less productive. And of course, as we get older, these glands will naturally decrease in efficiency. So, we need to restore these magical meibomian glands. How are we going to do it? One of the most exciting things about dry eye treatment today is this guy right here. It's called Tixel. What it does, it uses very high heat for a short amount of time, and it transfers that heat right into the gland. When that happens, it's going to liquefy the obstructions that are there and allow those glands to be more effective again. In addition, we will use LLLT, or low-level light therapy. This will help stimulate cellular repair and increase collagen production. We will treat 3 times, 2 weeks apart, so you can get the whole thing done in about a month. You can go about your day right after treatment. Just expect your eyelids to be a little tender for the rest of the day. After all 3 treatments, your meibomian glands will be working better. Your tear film will be more consistent. So when you have that blink reflex, you'll have a nice healthy tear film to help you feel comfortable, give a protective layer, and to help you see clearly. One of the reasons that we really like Tixel and low-level light therapy is because it restores the eye's natural way to lubricate. I would love to avoid chemicals or medications and just get your eye to work how it should and how it's supposed to. So in review, why do we treat? Well, obviously we want you to feel better, but we also want to prevent future damage. When these glands are left obstructed for a significant amount of time, they begin to atrophy and go away. And that's irreversible damage that we can't get back. If you have any questions about meibomian gland disease, dry eye, or ocular surface disease, give us a call, make an appointment. It's actually one of my favorite things to talk about. I appreciate you. I acknowledge the trust that you put in me to treat this disease. I take it very seriously. I can't wait to see you again. Until next time.